Okay, we can go ahead and get started. My name is Annalise Cavisto. I'm the marketing director at Great Dental Websites. I have with me today Jared Bullen from Hushmail. Jared, if you could say hi and you'll pop up on the screen.
Hi, everyone.
And then I have Jeff Gladnick, CEO and founder of Great Dental Websites.
Hello, everybody.
If you guys see on the bottom of your screen, you will see a chat option. If you guys have any questions, you can message any of the panelists directly, or you can chat with everyone who's in attendance. We also have the Q&A section. So if you guys have any questions that you would like Jared or Jeff to answer, you can put them right in there and we'll try to get to them during the webinar. Otherwise, we will be able to answer them after or follow up with you individually. We will be recording today's session, so if you guys don't get anything or everything you need out of it, we will be able to send you the recording. Anyone who's on the registrant list will receive that, and I believe Jared will be sending it out to any Hushmail clients as well. So with that, we'll go ahead and get started. So thank you guys for all attending today, and thank you to our panelists, Jeff and Jared. I wanted to go ahead and start off by talking about how the patient experience has changed recently. And I know that patients are expecting things to be much more digital and much more easily available. Like not everyone has printers in their house to go through forms. People like to schedule things online, and now we're seeing that trend towards telemedicine and teledentistry. So Jared, I'll have you start off by talking about how you have seen things change with your company, and then Jeff, if you have any follow-ups to that, we'll get going there.
Absolutely. So the online experience has definitely evolved quite a bit over the last few years in healthcare and areas well outside of that as well. And given the availability now of technologies for pretty much anything to be able to, fill out documents online, do your intake forms, health histories, all of that, because that capability has existed for some time now, there definitely is that expectation that that option is available. And like you mentioned, in a lot of cases, people may not have a printer to, print out an intake form, fill that out, scan it, send it back to you. So rather than just getting a blurry camera phone photo of someone's intake form that they're sending in, or trying to decipher someone's handwriting, it's now important to realize that there are tools where you can do all of that securely online. Because a big component of that too is, yes, these tools may have existed for some time now for collecting information or moving to telemedicine, but obviously you want to make sure it's something that is HIPAA compliant, that meets all of your compliance standards. And I feel like that's why there may have been some hesitance or some resistance to moving towards these more online tools.
I mean, the thing I'd add is the new patient experience that we've witnessed our clients transform in their own offices has been quite dramatic because of the COVID-19 effects. Where previously you were trying to, in some cases, show off the spa-like experience, and we had clients that would, in some cases, give out like heated towels, like you're getting into first class on a plane, and nobody wants to touch a heated towel right now. That's crazy. So the new patient experience that a lot of patients and practices seem to want to do is don't even come into the office, sit in your car, fill everything out on your phone. Ideally, like worst case scenario, somebody will come out with masks on and hand you a clipboard through like the 1 inch, sorry, I'm American, crack in the window, and then spray it with Lysol before they take it back in the office. So yeah, there's a huge advantage because filling things out on your phone is not ideal, but it's better than running a risk of getting sick for a lot of people. Being able to fill things out at your convenience at home in a secure fashion, I think is going to be highly desirable and seen as much more convenient. And I think most practices should at least consider having those options available for patients, and using clipboards and paper as an absolute backup. And that's what we see a lot of our clients doing.
Yeah, Jeff, as you mentioned, it's a great point that the pandemic has kind of forced people's hand a bit here, where it's made people adapt to doing things more online, reducing that contact. I just did another webinar recently with a dentist based in the Toronto area who came in one day to find just a stack of paper intake forms that were just all damp because his staff, with no other options really, had just sprayed them all down with
Oh,
like an
God.
alcohol solution trying to disinfect them. So obviously, the more choices you can offer your patients, the better, generally speaking. Some people prefer the ability to do everything online. Others may prefer, a pen and paper form, actually having that experience in the waiting room. But right now, with the current health situation, it's forcing a lot of people to adapt. And it's a great time to, do the legwork now to set yourself up for the future, and just to be able to offer your patients that choice when things do get back to normal.
Yeah, I see no downsides in giving people a choice. And sure, maybe some people like the waiting room experience of filling out paperwork. I personally have always abhorred that,
Mhm.
especially when I have to fill out like my birthday, social security number, like 5, 6 times on like different forms. Oh my God. A lot of that can be slimmed down if it's set up intelligently with digital forms. And I think a lot of people are going to go through this. And just like everybody's gotten used to Zoom video calls or whatever program you're using, I think a lot of people are getting used to filling out online data and online forms and intake for patients. And they're going to expect, some of them are going to expect it and be put off if they don't get it. And there's really, I think at this point, not a good reason. There's definitely not a good reason to offer that as an option now. But I think even after this, I don't think things are going to go back to normal. People are going to have learned some new habits, and some of them are going to stick with them, and they're going to like them and want to keep them going.
Yeah, and a great point you mentioned there too is just the fact that people are now not necessarily doing this from a computer where maybe they can download like a fillable PDF, fill that out and send it
Yeah.
back. But the ability to fill out your intake form on your phone while you're sitting in your car in the parking lot waiting for your appointment. So finding something that is responsive to all those different devices is a really key consideration too, because like we were kind of saying here, the more choice you can offer your patients, the better. That just makes an overall better patient experience if they can find something that works really well for them.
Yeah, and on top of that, like I know we have a couple clients, more than a couple now, doing teledentistry, and if that's like the initial consultation,
Mhm.
well, there is no opportunity for paper forms. Like this is all got to be digital. You don't even have a choice. So if you're engaged in teledentistry or you're considering it, then you kind of, what are you going to mail it to them?
Mhm.
You really have to have digital forms, period.
And I just switched to a new dentist recently, and after I set up my first appointment, I was emailed the forms to fill out through whichever program they used. But I know that I've seen on our clients, they also have them embedded on the website. How do you guys think it should be distributed to the patients? Should they just be available on the website for everyone to fill out? Should they be emailed? Should it be a combo of both? Like, what's the best way to make sure that those forms are filled out before that first appointment?
Well, I feel like with a form that has, say, like an intake form or something like that, having that available on a website is a great option, because that is going to be a lot of people's first point of contact with your practice. I know that's the first thing I'll do, to whether it comes to scheduling an appointment, anything like that. I'm always going to my dentist's website first. So having those there to fill out is great. Having the ability to send them out via email as well is also great for people who, maybe they email in to make an appointment, or they fill out a contact form and you can just send them everything at once. So you make sure they're actually getting all the forms they need completed.
Yeah, both is better. Having it on the website, I know we'll listen to calls sometimes, and the front desk will just say, "Oh yeah, go to our website and click on the new patient section." Oh yeah, there you go. You found the forms. Great. And that's easier for some people than just figuring out how to get it to them by email. But most practices are collecting email anyway, and if you're using any kind of patient communication system that's reminding people of their appointments, hopefully it can tell that they haven't filled out the form yet and it's reminding them. But as a worst case, you can just put links to all the forms or links to your new patient section on your website in that new patient reminder, and then they'll just get it that way. So I see no problem doubling up here, and only advantages.
And one consideration with that too is if it's a form, like say a consent form or something like that, that has that you need someone to sign electronically. And I know we'll touch more on the e-signatures later on today, but something like that, having it sent to a known email address, something that is actually verifiable, rather than just having it on a website where anyone could fill it out if it's embedded on the page. With an e-signature, actually sending it out via email may be a better option, because you kind of know who it is who's filling that out. But for your general intake forms, appointment requests, all of that, that's having the ability to do that directly from the website is a huge benefit.
Yeah.
And with that, I mean, we started touching on it. I know that when dental websites first started being a thing, 20 plus years ago, and even as recently as 10 years ago, it was more of a brochure for the practice where you went onto it, you found about the services, you found about the people, and then you called the dentist or the front desk and you talked about whatever you needed to do to schedule an appointment. And recently it seems like websites have become, the online scheduling where you can find reviews, where you can do send in your pictures before, and it's become more of a hub. What other changes have you guys seen with websites and how people interact with them as far as selecting their dentist and interacting with their dentist? Jared, do you want to start that one?
Yeah, absolutely. So with that, it's generally speaking, the more information you have, the better, to give people a full picture of your practice. I know for me personally, as a patient, if I can go to someone's website, if I can see, I can learn more about the practice, but also book my appointment there. If I can, submit a contact form to reach someone. If I can see, there are like a list of other reviews that people have left, then that's going to give me that confidence to maybe book with that clinic. The more I can do myself without having to pick up a phone and call someone, that is always going to be my preferred way. And I know I'm not alone in that. I will do pretty much whatever it takes to avoid picking up a phone and calling someone these days.
Yeah, a phone call can sometimes be a hassle. You don't know if you're going to have to go through the phone tree and wait on hold. It's a pain in the neck. I kind of feel the same way. I'd rather favor an online experience where I can just kind of quickly go through it. But I agree with Jared. We've seen a lot of third-party services that are being utilized by dental practices get integrated into the dental website. You have online booking, we've got forms, we've got reviews, we've got payment options. So there's all sorts of things that are kind of continuously evolving and need to be communicating with the patient schedule or the patient management software in real time that really need to be at home on your website. That and updates to mobile experience to accommodate the huge percentage of sorry, got a call to put away. The huge percentage of people browsing websites on mobile. Those are the two main changes from brochures to what we have today. It's just much more interactive today.
Do you guys see any major mistakes that people make when they're starting to integrate those different softwares and functionalities on their website?
One of the big ones I see is just neglecting that mobile experience, just kind of overlooking that, because you can have a great looking website when someone's accessing it on their computer, but if you're viewing that on your phone and things aren't loading great, if I have to go to select view the desktop version on my phone, it's not ideal. It's not a smooth process. So I think one area people overlook is how it looks on different devices, because you now will have people accessing it from their computers, their tablets, their phones, and pretty much any device now that can have a web browser on it.
Sorry, I had to let somebody in the house. I missed the first part of that question. Could you repeat that, Annalise?
Yeah, what mistakes do you see coming up with when people are integrating these different softwares and functionalities on their website?
I mean, most of it is siloing content or just keeping things disconnected. So you get you get some sort of plugin for reviews, and you just have a review section. It's well, that's good, but it'd be nice if the reviews were related to the service pages. So if you're on, or if you're viewing a before and after case about Invisalign, well, it'd be really nice to have a review or a testimonial right there. But instead, you send people on the scavenger hunt on your website and assume that they're going to find all the content that you want them to find to support your case that you're the right dentist for them. Don't make it hard for them. Same thing with online booking. We'll see people just like put that like in one spot on the contact page like that. That really needs to be an option everywhere you have a call to action to get in touch with the office. Like you can call, you can fill out this contact form, or you can go to our online booking. So it's more along the lines of like, well, they just are kind of checking the box of like, well, I've added that to the website, but they haven't really thought through the way that a patient would interact with that and put it in all of the places where it would make sense and give the best experience for a patient.
Yeah, that's a very good point. It's having that a really seamless experience for someone from the moment that they come to your webpage to be able to do whatever they really need to do, having that right in front of them, and having those different sort of calls to action on different pages is huge for making sure. Because if I'm reading about a practice and finding out more about the dentist, I don't want to have to then go look for a link somewhere else to book an appointment with them. If I can do that all from that page, I can say, okay, this is the doctor. Here's how you book an appointment with them, or here's what other people are saying about them. Having that all in one spot makes it so much more of a seamless, interconnected process.
And with that, when people are starting to interact with those practices, I know that recently some of those HIPAA laws were kind of relaxed during COVID because people still needed to be able to communicate with their medical providers. We're starting to see that, or that I think expires in the next month or two. How are we supposed to move forward with that now that people have become more dependent on email communication and texting their providers? How do we make sure that that information doesn't become compromised and we don't violate any of those laws?
Yeah, so with those laws being temporarily relaxed, it's great because it does allow people more flexibility to communicate with their patients. But honestly, it's a really good opportunity to get something in place for the future. This has been a great chance to try out different ways that you may be able to engage with your patients. And while we see different telehealth services, things being approved for maybe meeting with your patients, like doing a Skype call or using Zoom or something like that. If you can actually set yourself up for something for the future, then it's going to be a much easier process to integrate this when these regulations do go back to normal. Because, well, they've relaxed these temporarily to kind of meet an urgent need. At the end of the day, you want to make sure you're protecting that patient information. And even though something may be temporarily acceptable, that may not be the best practice going forward. So you want to make sure that you're able to continue offering these services, but doing so in a way that protects your patients and it also protects you. So you're not coming up against a massive fine or something like that for improperly storing this information.
Yeah, I'd agree with that. If you're going to go to the trouble of, going digital or using greater email or telehealth like features, it really doesn't make sense to use something to get set up on a system and trained on a system and get your patients using a system that you're going to have to throw away whenever this goes away. Even if this is extended, it's not going to be forever. There's going to be some sort of regulation that eventually comes back. And even in the meantime, like if you're protected and your data gets compromised, how is the patient going to feel like, don't worry, we didn't break any laws, but we still did lose all your information? Are they going to be like, oh, great, no problem, as long as the laws weren't broken? They're not going to care. They're going to still be really angry at you. So I would, I would just kind of do it right and take the opportunity being forced on you to offer this to just do it right now so you don't have to worry about it in the future.
Absolutely. And yeah, it is just more than the legal considerations there. There is an ethical side of it too. And you want to make sure you're doing everything you can to keep your patient's information safe. I know I would be pretty upset if, even though someone was abiding by all of the relaxed rules, if my information was suddenly out there. So yeah. Yeah, exactly. So it's, like you were saying, if you're going to be putting in the legwork now to get these different communication methods in place, why not set yourself up for the future? Why not find something that is HIPAA compliant, something that you can actually use going forward? Because not only are these rules going to change eventually, but your patients are going to get accustomed to these new ways of interacting with you. If they have the ability to, engage in more telemedicine, or have more of their experience online, I know personally I would prefer to have that option. So if you can continue doing that, so you don't have to stop offering these new ways of engaging with your patients once these rules do change, then you're setting yourself up for the future, and you're building a better patient experience.
And with those patient experience and those emails and everything, I know that sometimes even just from my clients, when I'm talking about marketing, I get encrypted emails from them, and I have to log in and do that because they have some sort of program already installed, and I think they just forget to turn it off and on. Which of those emails, I know in my case it doesn't have to be encrypted, but what emails from those practices should be encrypted, and at what point does that start? Does it start once they become a patient? Does it start before that? Like, how do we make sure that those are secure from the very beginning?
So really anything that contains any protected health information about someone, and there's a lot of different identifying features that are considered PHI. So it's everything from someone's last name to, I think, their license plate number is even like in cases considered PHI, because that's something that can be traced back to them. So anytime you're communicating with someone and it relates to something specific with their personal health, something that acknowledges that they are a patient of yours. So an appointment reminder, for example, that's something you want to make sure is secure and encrypted, because that does acknowledge that patient relationship. Whereas if it's an update about your hours changing because COVID-19, some of the restrictions are relaxing a bit, and you're able to open up more, then maybe that's something that doesn't need to be encrypted, because that's just going to be an extra step that someone needs to take to find out that important information. But anything that's going to be able to say, this person is a patient of mine, anything relating specifically to them, that's really important to encrypt, because the encryption there allows you to be HIPAA compliant without really a lot of other steps. So even with just a regular email, you could still, if that's sent over an encrypted, like a secure connection, that's something that could still be HIPAA compliant, but you have to do things like inform the patient of the risks of communicating via email. You need to get their consent for that. You need to document their consent for that and have that on file somewhere in case you ever do get audited. If you're using encryption, you can kind of take those extra steps out because the security is built in. So I think it's important, as soon as you start engaging someone as a patient, you've received an intake form from them, then if you're communicating with them in the future, having a secure way to do so is really important. And even having a secure way for them to send their information into you. Because while HIPAA is more concerned about the information that you're sending out, you're putting out into the world, it's a really great practice to have something where someone can submit all their information to you securely as well. So obviously you're not going to be liable if someone just prints out their personal health file and just leaves that on your doorstep. But if you can provide them with a secure way to send that information to you, it's a better patient experience. It protects their information more, and it allows you an easy way to get back to them securely.
How do you guys recommend threading the needle between convenience and security for practices? Because I know personally, like, I've gotten emails from medical practitioners or even my bank, and it's just like, okay, great, we'll see you on Tuesday. And it's like, I didn't need that to be encrypted. If anybody found out that I was just getting like a hygiene appointment on Tuesday, like, that really would not be a problem for me. But on the other hand, if they found oral cancer, that is something I would like to be, I don't want that shared. So is there a way, it sounded like you touched on a little bit where you just needed a sign off from them to say, look, appointments are fine, that's great, but other things may need to be encrypted. do you guys have any guidelines for how to kind of set the marker from super secure and nobody can get in, but slightly more convenient to highly convenient and completely open? Where do you guys typically recommend practices kind of set that threshold?
It's finding that balance is a really kind of, it can be a kind of tricky thing. And so I think finding just an email service that allows you to do that, to send things as encrypted when you need to, send them as non-encrypted when you don't, having that flexibility is really important. And one thing to note too is that even when you're sending a technically a non-encrypted email, some mail providers like Hushmail, we will still try to send that over a secure encrypted connection. So at least that's, it can't be intercepted on the way. But yeah, well, there may be that fear of inconveniencing patients with maybe an extra step. Generally, I found that most people are pretty appreciative of the care that someone is taking to protect their information. Even if it may be something a little more innocuous, maybe, yeah, I don't care really that I'm getting a cleaning on next Tuesday or something like that. But if someone is taking the care to protect that information because that can, contain some of your protected health information, that really goes a long way. Honestly, the big thing when it comes to how you're communicating with patients is doing a risk assessment on your end, figuring out, what the consequences are of communicating in these different ways if this information was to get out. So that could be consequences from a legal standpoint, from a compliance standpoint, what your liability there is. So doing that risk assessment, setting policies and procedures for when it's appropriate to contact someone via email, when it's best to pick up the phone. Each clinic should really be doing this. And that is actually a part of HIPAA compliance too, is just documenting your policies and your procedures and doing that risk assessment. So if the worst were to happen, if this information was to fall into the wrong hands, what are you doing to protect it? And also, what are the consequences of that?
Makes sense.
And Jeff, on the website end, I know that we have a lot of clients using a lot of different widgets and functions, like the online scheduling, chat, all of that. How do you make sure that when that's installed on the website or embedded on the website, that it's also secure?
We're kind of reliant on third-party providers for that. So, our approach for our clients is to give them full access to update their back end and make changes to their website. So they technically could embed something that wasn't safe. So if you're concerned about that and you're a client of ours, I just recommend you just contact our support and we can quickly tell. Usually it's using HTTPS, so it's at least somewhat encrypted. Or oftentimes we've heard of the company. There's a lot of dental specific companies now that have a reputation, and you see that, and Hushmail, who we're on with today, is one where we already just know that they're vetted and they're good to go. So that's been our approach, but we kind of have to evaluate it one at a time if we haven't seen it before.
And when it comes to things that are, interacting with your website there, even with something like, online reviews and everything like that, that is actually another kind of a sticking point that we'll see when it comes to HIPAA compliance. So how you respond to, an online review could technically be a breach of HIPAA rules. There was one case where someone got a fairly significant fine for responding to a negative Yelp review and acknowledging that person was a patient of theirs. So, you want to give people that transparency to see all this on your website, to see all the good reviews you're getting, but just be careful when you are replying to those, when you're engaging with those people, not to confirm that they are a patient, or, you could be on the hook for some significant damages there.
From a PR perspective, you have to be very careful replying to negative reviews in the first place.
Absolutely.
Forget about the HIPAA. Well, don't forget about the HIPAA implications, but put them aside for a second. Like their PR implications of, even if the patient is totally wrong or crazy, you have to think about who the audience is. You're not going to win this person over in a debate. You're really thinking about other people who are going to read this, and you really want to respond generally and come off, compassionate and understanding, because other patients aren't going to want to come to a place if you look very reactive and you're ready to jump down a patient's throat who came to you who they had a disagreement with. We've all had disagreements with businesses, from time to time, and you don't want that business attacking you online, even if they were wrong. So just keep that in mind. If you have a negative review that's making you seethe and frustrating you, keep it legal, follow HIPAA guidelines, and keep it polite.
And also adding to that, if you're a client of ours, or even if you're a client of Hushmail, if you guys need some help with that, just shoot it over to our support. We can help you craft a response that won't get you in hot water or make you look like a jerk to other patients too. We know it's frustrating and terrible to have to deal with that, but we can help, and having a third party would help as well. And with the security side, and going a little bit more on this, I know that when I fill out forms, sometimes I just hit submit and it's there. And when we were talking about e-signatures a little bit before, you're talking about that being more legally binding. Jared, can you go a little bit over the difference between just hitting submit and saying like, I authorize this versus an actual e-signature, and what that looks like and how it changes the liability for the practice?
Absolutely, yeah. So there are different circumstances where you may want to use an e-signature. And I will just caveat all of this by saying that I am not a lawyer. If in general, something like a consent form, an authorization to release information, maybe to another practice, that's something that you're going to want a legally binding, a verifiable signature on there. Because if it's, say, a form, just like a regular intake form where you don't have to, you may not have to sign to agree to anything or anything like that, you can just submit that back. That's fine. It's your information that you're submitting. But in the case that you're agreeing to something, whether it's like a financial policy for a practice, or that you've read their privacy policy, when you're agreeing to something like that and there are potentially consequences for getting that wrong, then that's something where you want to make sure that there's a signature on there, and that also it's a signature that's verifiable in some way. So with our secure forms, when you get an e-signature on them, you actually send out a signing request via email. So it goes to a known address. Someone can then sign that in their web browser. It gets sent back along with something that includes, their IP address that they've signed it from. You can see when they signed it. It's got an automatic timestamp there. So it gives just a little more credibility to the fact that it is the right person who is signing this. Whereas, another solution, if it was just, say, checking a box to say you agree to someone, there's not really a lot you could do if you needed to verify that it was the actual, the person who you think it is who's filling that out. An electronic signature that's going to a known email address or has some other level of verification there goes a long way to actually meeting all of the requirements to be a legally binding electronic signature.
Sorry, I forgot my mute button there. And with that, you were talking about having the emails sent out to you. So how would you recommend a practice, let's say that they have their forms online and they're also you want to have that e-signature? How do you propose the order for that? Like, how do you make sure that the person filling out the forms on the website is the right person?
So a great thing we'll see people do is maybe they'll have a form embedded on their website to request an intake packet. So they fill out a simple form with just generally their contact information, the information that they're looking for. They submit that to you directly through the website, so they can do everything without ever having to leave your website. You then get an email back saying that, this person has submitted a request through your website for an intake packet. So you can reply to that email. You already have their email address there. So you can send that all off to them. They then complete the forms they need to, sign them electronically, and those get sent back to you. So that makes it a much more seamless process where you're kind of managing everything securely from A to Z.
Awesome. And a little bit more on those forms. I know that you guys both see a lot of new patient forms on websites and through your software and all of that. What do you guys think are the biggest mistakes? I know, for instance, I saw a website recently that we were looking at potentially bringing on as a client, and they had like 30 different forms, and you had to sift through and find the right ones that you needed. How can people make that an easy process and get rid of any information that's just too much or makes the process more daunting for a patient?
I think one of the biggest mistakes is, yeah, just requiring way too much information. Having I've seen cases where someone has a 27-page intake form, and that's a lot for someone to fill out at one time. So I guess just thinking about the information that you need for every single patient, that should be your intake form. If there's maybe cases where you need additional information, then having a separate form for those particular cases makes a lot of sense. Other times it's just a formatting issue where if it's all like a giant, long intake form, it just seems daunting. I don't personally want to fill that out. If it's something that can be condensed, it can look a little better, then by all means, I feel like it's going to take up a lot less of my time to actually to fill that out.
Yeah, the respect for people's time is a big one, and there's been a lot of studies done on forms, and the more form fields you put in, the lower the completion rate is. And so being conscious of that and trying to minimize things to what you need, as Jared said, is dead on. The other thing is just making sure it works on a mobile device. We still see dental websites where they have online forms, but you have to kind of like pinch and zoom, and like it's like this map where only part of it has been revealed, and you got to like look through this hole and try to figure out where all the fields are. And sometimes you get error messages that are like off the screen, you can't even see them. You're hitting submit and you're like, why is this form broken? It's not broken, it's telling you that there's a problem, but it's off the screen and you can't see it. So make sure that you test your forms on a mobile device, and deliberately screw them up and make sure that they fail, and they fail gracefully, so the patient can know why it failed and fix it easily and quickly.
Another thing too is one of the more common mistakes is just not proofreading it. It's really unprofessional if I'm filling out a form for someone and there's spelling mistakes or grammatical mistakes, or it just doesn't look polished. That's going to negatively affect my perception of the practice. Another thing too that we see commonly is people just using all caps for emphasis, which just kind of comes across like they're yelling at you. So those are a couple things that may often get overlooked when you are creating your forms that can have a noticeable impact on someone's perception.
Awesome. Those are the questions I wanted to go over today. Do you guys have anything that you wanted to talk about in addition while we wait and see if anyone has any questions from the audience?
I think we covered the topics well. Jared, do you have anything to add?
No, I feel like we've gone through everything we set out to today, so that's great to see. One thing I did just want to mention is, so we will be sharing this webinar through our own channels here as well. We also have a couple blog posts on our Hushmail blog, which is just blog.hushmail.com, that go through some of these form building mistakes that we see, that go through cases of when you'll want to use an e-signature. So there are some supplementary resources there if you want to do some further reading on it. If you still have any questions, that would be a great place to start.
Great. And can you guys give out your contact information in case anyone has any questions and wants to follow up with you? Jared, if you want to start.
Yeah, absolutely. So I can be reached at just sales@hushmail.com. Feel free just to put my name in the subject line or mention that you came to us through the webinar here, and I'd be happy to help you out.
You can reach me at Jeff, Jeff, at greatdentalwebsites.com, or just go to our website, greatdentalwebsites.com.
Easy enough. All right. I don't think we have any questions for now. So if you guys think of something later, please please contact us through either the emails that were just given out or either of our websites. We'll be sending a recording of this as well if you guys wanted to replay it. And also, we posted a blog on behalf of Hushmail on our website yesterday about e-signatures. And I know that we posted a blog on Hushmail's website about having a website, having an effective website and making sure that it works for all of your patients. So if you guys wanted to read a little bit more, please feel free to do so. And with that, thank you all for attending today. And thank you again to our panelists, Jared of Hushmail and Jeff of Great Dental Websites.
Thanks, everybody.
Thank you very much.
All right, have a great day, everyone.